been getting a lot of questions about treating the root cause of eczema in children and babies. People are asking me, how do you do that? How is that different from treating with conventional medicines like topical steroids and Dupixent and biologics? And so I'd like to talk about this topic today because I know everyone's confused. You go to your pediatrician and you get topical steroids and they basically tell you that's all you really can do. Maybe you can go to your allergist and get food allergy testing. And that's really the only answers that are often provided. Maybe they might recommend bleach baths. And, I don't really feel like a lot of that is really long term solutions for you. A lot of those answers are solutions that are just silencing those symptoms, and so I want to talk about it today for your children. How can we get to the root cause of eczema and really clear it for good? Address the reasons why they have the eczema in the first place so that this doesn't become a long term problem for your child. This doesn't morph into other problems that are potentially more harmful, So let's talk about it, okay? So today's agenda, we are going to talk about why conventional treatments fall short for eczema, the most common root causes of eczema in children and babies, and then what's my three-step approach to healing eczema naturally? And so what is the holistic approach? And so we'll talk about all of that today. At the end, you can ask questions. So please definitely type into the chat or the comments box. And I'm happy at the end to go over those questions and answer everything you have on this topic. Okay. All right. So let's start with why conventional medicine falls short. How does conventional medicine address and treat eczema? Well, the paradigm is a little bit different. When we are talking about conventional medicine, we are often just trying to lower the symptoms of eczema, the itchiness, the redness. That is kind of the main goal. And so, because of that, we're using topical steroids as really a first line defense. Often we're using antihistamines, as medications that we might use to lower that histamine response. And then topical steroids are lowering that inflammatory response at the skin. Now, there's some problems, right? So, with topical steroids, we're really only silencing those symptoms. We're not asking why we're having those issues, but they work pretty well, right? And they can work for some time. For some people, they end up not working eventually, or you have to just keep going stronger and stronger with the potency. So that can be problematic. There can be side effects, unfortunately, like thinning of the skin. You can become really dependent and addicted to steroids, topical and oral. And then you can have these rebound flares when you use them for prolonged periods of time. And then this leads to something we call TSW, or topical steroid withdrawal. And there's also something called topical steroid addiction. And so, that's one of the problems with just going with a conventional approach. For babies and children, particularly, steroids can be problematic because their skin is so thin that they are potentially absorbing these steroids, and it can affect their hormones and their hormonal development because steroids are hormones that our body creates in our, naturally. And so when we're giving these hormones unnaturally, then this can disrupt that growing system. And so we want to try to avoid these as much as possible. Another thing that conventional doctors might just recommend is moisturizers, things like Aquaphor and Vaseline and Cetaphil, et cetera. And that can sometimes help to really support that skin barrier, but often it's not enough. And you might notice that this is not just dry skin. This is an inflammation that's happening at the skin. And because there's inflammation, we might see some dry skin, which moisturizers can, of course, help. But some of these moisturizers that a conventional doctor might recommend end up having, toxic ingredients that we don't want. Maybe things like petroleum or mineral oil and things we actually don't want to put on our skin, and can actually lead to more of a problem, unfortunately. Your doctor might tell you to go to an allergist and, okay, let's get some allergy testing. And, not a bad idea. So we can see if your child has any allergies. But what I find is that, sometimes we want to look actually with chronic inflammatory conditions like eczema, not only allergies, but we also want to look at sensitivities and intolerances. And these are a little bit different. So, sensitivities can be a low level inflammation. You eat the food or your child eats the food today and doesn't actually get a reaction for 3 whole days. So, that's how it can be hard to identify if you don't have testing. Intolerances are maybe your child, is lactose intolerant, doesn't actually make the enzyme to break down lactose that's found in dairy, and that would be an intolerance. Your doctor may recommend just doing an elimination diet with no testing. And, this can be really restrictive. And if we don't really know what we're trying to take out, it can be a little bit difficult to do. And finally, a newer type of medication on the market are called biologics. And these are medications like Adbry or Dupixent. And these come with risks themselves. We can see that, this is really just lowering the immune system response, just like topical steroids, but in a different way. These biologics are often lowering the cytokines or the inflammatory markers that are actually causing inflammation at the skin juncture. And we can see problems here. For example, with Dupixent, we can see a lot of eye issues, conjunctivitis, and even eye issues that can potentially even lead to blindness. So, these medications do not come without risks. And so I really invite you to think about treating your child holistically, really understanding what the root causes of your child's eczema are before you ever think about these conventional medications. And you actually think about these conventional medications as emergency medications that you use when things are just really bad, you can't get it under control, and you use these sparingly for a short period of time. I think the problem in conventional medicine is we're not really thinking that way. We're thinking that these are the only solution. And I personally have experienced myself, I was a child with eczema. I, had eczema until I was 30 years old. And that was when I ended up going to naturopathic medical school and getting to the root causes of my own eczema that I actually cleared it for good. And now in my practice, I work with a lot of kids because unfortunately, as I did another episode a while ago, we talked about the eczema epidemic. This is a problem in today's world. We are having issues with our kids having eczema because the world is so toxic, because we have medications that are affecting our microbiome. And we're going to talk about that now. What are the top 6 root causes of eczema in children and babies? And let's talk about why this is affecting our kids. So microbiome imbalance is the top of my list. And microbiome is basically you have microbes in your body. You have trillions of them, in fact, and they are helping your body to operate well. They are digesting your food. They are creating nutrients in your body. And I'd like you to think of your microbiome as a nice army. And so you really want a diverse army. Unfortunately, there are problems in today's world that may be causing these microbiome imbalances in our children. So, first of all, we get our microbiome from mom typically. And if mom doesn't have a good microbiome, if mom has any issues like eczema or any other chronic issues, it's possible mom doesn't have a great microbiome to transfer onto baby. But the next problem is how we're actually birthing our babies. If we are having C-sections, which of course sometimes are out of our control, our babies may not be getting as much of the microbiome as we want them to get, that they get through the vaginal canal. And so that could be problematic and something we can fix, once the baby is born. Feeding choices such as formula feeding really cause babies to miss out on those beneficial probiotics and prebiotics that are found in breast milk. And of course, there are things that we can do there if we're unable to breastfeed. And then early antibiotic use. We are actually seeing the antibiotic use in pregnant women during labor and postpartum, and then in babies really early on, even as early as day 1 or day 2 of life, is really causing the microbiome to really not be what it should be at even just at birth. And I have a recent patient who their child had antibiotics on day 4 of life, and then we looked at those labs. And the child basically has zero beneficial bacteria, no lactobacillus, no bifidobacterium, and all of those commensal bacteria. Commensal bacteria are the bacteria that are supposed to be in our gut, were really, really low. And so this is something we can test for. And so we'll talk about that in a minute. Okay. Toxic burden is our next top root cause. And unfortunately, we as mothers are transferring our toxins onto our babies. And that's why a lot of babies and children can have this at the get-go. And we are transferring it via our breast milk, postpartum. We are transferring it via our placenta when baby is in our womb. And then baby is also getting a lot of toxic exposures because unfortunately, we have so many toxins in our world today, unfortunately. So, household chemicals from cleaners and detergents and personal care products, air pollution and contaminated water, pesticides, heavy metals in food. The air can be really toxic. We can have mold in our air. So, there's just so many toxins in our world today. And babies and children are exhibiting eczema because their systems are saying, hey, our livers, our kidneys cannot handle these levels of toxins. This is not normal. This is not natural. Okay, so we have to address that. Leaky gut is the next top root cause. And when there's leaky gut, often your child may have a lot of food allergies or food sensitivity. So if you're seeing this, you may want to think about, okay, maybe we should test for leaky gut. If there's leaky gut, sometimes there could be some bacterial infections or viral infections. And then if your child has used a lot of antibiotics, then you might get this leakiness in the gut. So, what is leaky gut? Leaky gut is when there's so much inflammation in the gut and the microbiome isn't healthy. And so the cells of the gut, instead of being really close together, they actually start to separate. We call this intestinal permeability or leaky gut. And when that gut is leaky, we can see particles that are not supposed to be leaking into our system leak into our system and trigger an immune response, which looks like eczema. Okay. And so that's where then you could see a lot of food allergies, food sensitivities. If you have a lot of chemical sensitivities, if you're just super sensitive to everything, you might have some leaky gut. And this is something we can test for. Leaky skin. This is often there could be a genetic component here. So we see mutations in the filaggrin gene can affect the skin barrier function in our kids. But I will say this is not the most important thing to worry about. If you worry about this, you might say, oh, well, there's nothing we can do. This is just genetic. And I would say this is only a portion of the root causes of eczema. This kind of predisposes you to have leakier skin, which means you might have more sensitive skin and you might be more sensitive to soaps and laundry detergents and chemicals and personal care products and things like that. But it's still about the toxic burden and the microbiome imbalances that actually exacerbate this issue, okay? So using harsh soaps and fragrances can be a problem and can cause more leaky skin. And actually, if the child has a lot of nutritional deficiencies, then that skin barrier is not going to have what it needs to be really strong. So we need to worry about that too. Nutrition is a big one, and this is something your child is doing 3 to 10 times a day. If breastfeeding, you might be breastfeeding 10 times a day. And so mom, you could actually, if you're breastfeeding, you could be eating things that baby is sensitive to or allergic to. That's a possibility. You could be giving your child some foods that they are sensitive or allergic to and you just don't know it. And again, with sensitivities, you can be giving a food today and they actually don't get a reaction until 3 days later, potentially. That reaction is super low level, so you don't really know that it's happening and you don't know why it's happening, and your child just has eczema. Okay, so sensitivities can actually be this kind of secret root cause that is really hard to identify. It's different from an allergy because an allergy, you might eat something and like immediately you have a response. Okay. Nutritional deficiencies are also prevalent in eczema. Things like zinc, omega-3, fatty acids, vitamin D are really common in children with eczema. And this can really slow healing. It can, if you're low in these nutrients, you could have low in immune function. Inflammation could be higher because omega-3s, for example, lower inflammation. So we want to look at those nutrition factors. And finally, the sixth root cause is lifestyle factors. So even in babies, stress can really affect them. So I noticed that this actually is stress typically in the family household when it's a baby, even when it's a child, your baby or your children, they are soaking up all of that stress that you are experiencing. So I often see this in the parents actually. And of course, when they are very itchy, they might not be getting great sleep. That itchiness can disrupt their sleep. Excuse me, that itchiness can disrupt their sleep, making eczema really hard to manage. Excuse me. And, our kids are typically having a lot of physical activity, hopefully, but we need that movement in the body. And so sometimes I do recommend even lymphatic drainage massage because movement. Some of our kids aren't moving a lot just because their skin is hurting and they're not able to move. So these lifestyle factors are very important. And I like to really identify, okay, which lifestyle factors are causing the biggest problem here and what can we do to optimize those? And that really considers most of the top root causes that I typically see in my patients. Of course, there's lots of other things that can come into play, hormonal dysfunction and other things, but these tend to be the top 6 root causes that if I assess a child, I often find that it lies in one of these areas, okay? So, why do babies in particular have these issues? Well, we talked about how our society, our world, unfortunately, very toxic. We're using medications, even in the laboring process, and when mom is pregnant, and antibiotics and things like that. That may be actually part of a cause here, which is what I talked about in the episode, the the eczema epidemic. But then there's other problems. Our babies have very immature immune systems. They're born with an immune system that's still learning how to differentiate between what's harmless and what's not harmless. And so the baby may actually create some immune responses that are unnecessary to foods. And so I really like to introduce foods in a specific manner. That gut barrier, remember we talked about leaky gut, is still developing. So we want to be careful with the things that we are exposing to the gut. So the foods we are exposing. That skin barrier is also very sensitive. Their skin is still very thin and permeable. And so we want to be careful with what we put on baby's skin. Baby is growing very rapidly. And so baby needs a lot of nutrients. And unfortunately, a lot of our foods are deplete. We are not eating nutritious foods. We are eating processed, nutrient deplete foods. And so that can be problematic. There are so many environmental exposures in our world today. And, our children, their livers and their kidneys are not fully developed yet to tolerate some of the levels of toxins that are in our world. Okay. So that's some of the reasons you might see a lot of eczema in babies and children. And your doctor might say, oh, your baby's just going to grow out of it. And what I often find is that they might grow out of the eczema symptoms, but if you don't fix the root cause, they may actually end up with other types of problems, let's say gut issues, headaches. Their immune system's really poor. They get sick all the time, and this was actually my case. My mom didn't know any better. Conventional medicine didn't really help us, and I was just using topical steroids. We weren't getting to the root cause. And as I said, I had eczema until I was 30 years old, until I figured all of this out. And I was getting headaches as a child. I was sick all the time. I remember being sick just every week, every weekend, and my tummy was always hurting. I remember just not being able to participate in any of the activities because my belly was always hurting. And so it progresses if you don't get to the root cause. So we do need to get to the root cause. So at Clean Body, we like to take a 3-step approach. And step 1 is we really need a thorough evaluation. Our journey always starts with what I like to call a root cause consultation. And that's because I want to help you understand what the root causes of your condition are, of your child's condition are. Let's talk about what happened. What's the story? I like to listen to the whole entire story. I like to figure out, kind of like a detective, like what are the pieces that are missing here? And let's do some testing to confirm that. Let's look at some journal entries. I really love journaling. My patients are journaling pictures of skin, poop even, because what's coming out of the body is as important as what's going in the body. It tells me a lot about the gut health. I like to see food pictures. What are you putting into your child's mouth? And so I review these journals, and that really helps me. And then, I do have patients who see me in person. I have patients who see me virtually. And so if someone comes into my office, we can also do a physical exam, which is great because then I can actually check all the organ systems. In addition to checking them via labs, I like to just palpate them and see if there's anything that I can figure out just by doing a physical exam. So that evaluation piece is very important. At Clean Body, I like to say it's a 360 evaluation. Often when we go to our pediatrician or our dermatologist, we're not getting this 360 evaluation. I know this personally because, as I said, I was in and out of doctor's offices my whole life. And often they look at your skin. Sometimes they don't even look at it, or sometimes they don't even touch your skin. And they say, okay, here's a prescription. And here is a referral to an allergist. I think those are the answers there. So I really like to take a very thorough evaluation because often we can hear it in the story, we can see it in the journals, and then we see it in the lab. So, by taking this 360 approach, we can really understand what's going on. Next, once we're waiting for those labs, I like to optimize what I call the 5 pillars of health. And this is the problem in 75% of my patients is there is something going on in your pillars. You're either eating food that's inflammatory, you're allergic, you're sensitive to the food, you don't have enough nutrients, you're super stressed out, or your family's super stressed out, and so it's affecting the kids and the babies. Maybe the child isn't moving around a lot. Maybe that lymphatic system isn't pumping. Maybe there's way too many chemicals or toxins in the environment. Or maybe you guys just don't have a routine where the child is drinking enough water, having daily poops. And so we got to figure it out. And 75% of the battle often lies here. And so that's where the evaluation is so important because we need to understand, okay, where do we actually need to fix the problem? And so your journaling really helps in this process. And step 3, we need to support with natural remedies. And I'd like to stress natural because the natural remedies often don't come with a lot of the side effects that the conventional medications come with. And I love to do things like healing baths that have oatmeal and hydrogen peroxide and magnesium and lots of just soothing nutrients to really help that skin to heal faster. Natural topicals. I love topicals like hypochlorous acid, topical probiotics, castor oil, shea butter. These are nourishing. Hypochlorous acid is antimicrobial, but it actually is something that our bodies normally make. So it is natural to your body's constitution. And, we have a topical kit called the Clean Skin Topical Kit, and that's a good start. But I also have a lot of other topicals I might use that are natural that get at the same root cause of, okay, let's really try to have antimicrobial topicals so that we don't have staph infections and we don't have malassezia infections. And then, we do things to soothe the skin because we do need to heal internally and externally as well. So with eczema, it can be a much faster process if we do both. And so internally, I like to change nutrition and lifestyle based on whatever I find. And then I like to use supplements and herbs. And we can use supplements and herbs on babies and children. When I'm dealing with babies, I'm often using very, very, very gentle dilute herbs, homeopathy. And I might use liquids and powders that we can mix into applesauce or mix into the breast milk. And then if we are seeing children, we might do chewables. We might do supplements that we can put in smoothies. So understandably, it can be difficult to sometimes get supplements into children. So, I have a lot of experience with that because unfortunately, we see a lot of pediatrics in our practice because eczema is something that really just affects a lot of kids. So, kids can heal, and they actually heal much faster than adults because they are so vital. They are ready to heal. And often there are just walls that are blocking their healing progression. And one, we have to just take away those walls. Like, what is it? Is it dairy? Is it gluten? Is that the wall? Or do they have a microbiome imbalance? And so we just need to make sure we give them good probiotics. We have to give them things to support the gut's immune function. What is it? We just need to figure it out. Once we figure that out, those walls come down and the body heals really quickly. The body is so vital. It's growing. It's ready to heal. Adults, I would say, a little bit longer of a process sometimes not as vital, and sometimes adults don't heal as quickly. But with children, if we do the right thing, we often see very quick healing. Okay, so healing your child from the inside out is a stepwise process, and it really starts with understanding what the root causes are. So, if you are interested in understanding what the root causes for your child are, we do have a free root cause assessment. And so, definitely check that out. You can check the link in my bio. If you are on Instagram, you can send me a direct message, and I'm happy to send you the link directly. And that's really a good place to start is try to understand what the root causes are for your child. When you do that assessment, you'll see that you'll get a results page, and you can click into that page, and you can understand, okay, my child has a really high microbiome imbalance. Okay, click into that page, and you'll see now, okay, what is there to do? Well, if there's a microbiome imbalance, you'll see that we want to do some gut testing. We want to do a stool test or a poop test. And we want to understand what the microbiome looks like, the good bugs, the bad bugs, the pathogens, the parasites. Is there leaky gut? Is there inflammation in the gut? Is your child digesting food well? And then we might also want to consider food sensitivity, food allergy testing. That's a really common one we might do as well. And this will tell us if there are allergies, but also are there sensitivities, and that can be really helpful. And it's not necessarily something we want them to avoid for the rest of their lives. When there's sensitivities, we often like to have them avoid those foods for a short period of time. Let's heal everything up, and then we can resume those foods in moderation. Another one I really like to do is a toxic burden test. So let's say you fill out the assessment and your child has a lot of toxic burden. That toxic burden score is really high, then we might want to think about running toxic burden tests. We might look at mold toxins. We might look at heavy metals. We might look at environmental toxins like pesticides, plastic toxins, etc. So, this is where that root cause assessment can really help at the get-go. So it's a great place to start. If your child is dealing with eczema, definitely start there. And I want you to know that there are so many answers beyond topical steroids, beyond Dupixent, beyond just putting moisturizers on. And it really does require thinking deeper into why this inflammation is actually happening. And there is always an answer. Okay, there's always an answer. We cannot, assess a situation and not come up with an answer. That's never happened for me. Typically we know what's going on, and then now it's a matter of just taking those steps to address those burdens, to get those walls down so that your child can heal. Okay, so if you are interested in meeting, if you want me to assess your child, we do offer a root cause consultation. You can DM me, and I'm happy to give you the link for booking. You can ask me questions if you're interested in learning more about how we can work together to address the root cause of your child's eczema. There is a 100% money back guarantee on this consultation. So DM me, ask me questions, or click the link in my bio to book the consultation. Now I would love to open it up to questions. So we are talking today about treating the root cause of eczema in children and babies. And so if you guys have any questions, please go ahead and type into the chat box now. I'm happy to answer any and all questions that you have. And someone is asking, so lactose intolerance have high risk with eczema? So yes, with lactose intolerance, we do find that is something that can happen in kids with eczema. And, that means that your child might just be intolerant to lactose. Sometimes, though, it's not just the lactose, it's actually the proteins in the dairy. So things like the casein in the dairy or the whey in the dairy, that could be a problem. So when we do testing, we often look for that as well, too. We'll look for the proteins, whether your child is sensitive or allergic to those proteins, okay? All right, and any other questions, please go ahead and type into the chat box now. I'm happy to answer any and all questions on this topic. And let's see. I'm just going to go back up because I know I missed some comments. Oh, you are great. Thank you for what you do. You're very welcome, Sandra. I sound like you know. Oh, it sounds like you know exactly what you were talking about. So, Sandra, I have been through this myself, and now I'm only treating people with eczema mostly, and a lot of these are kids. And so, this is something I'm very familiar with inside and out from a personal place as well as clinically as well. So, thank you so much for saying that. And yes, this live will be saved and it will be published on my Instagram. I also do these lives every week on Wednesday at 12:30 p.m. PST, and we actually do save these as podcasts. And so you can also follow my podcast live with the eczema doc, and these will actually go on the podcast. This one will be published in a week on my podcast. So definitely check out my podcast because there is a lot of good info there if you have a child with eczema or if you yourself have eczema. Someone is asking, do you recommend a GI map stool test? I actually really do like the GI map. That is one of the tests that we typically use in my practice for understanding the gut health. Um, Among other tests that we use. So I often will decide, what is the best test. There are other tests that we can do and some other things that I might look at that where I would choose not a GI map test, where I might choose a different test is, let's say I think there might be a parasite in a patient and I actually want to get a macroscopic exam of the stool. The GI map test does not have that as an add-on, but there is another test called the GI effects where I can add that on. And so I may choose a different stool test to do. And there are a number of stool tests that I typically choose from, and I usually choose the best one for the patient. I do recommend if you decide to do this testing that you do get it with a healthcare professional, just because, when you get the test, you may not understand how to read it or what to do with that information. And sometimes people will see that they have, let's say, a parasite or something, and then they might do a parasite cleanse, but they don't know how long to do the parasite cleanse for. They don't know what dosing to do, and sometimes you can actually further imbalance your microbiome by doing things like parasite cleanses, etc. And then especially if you have a child or a baby with microbiome imbalances, I do highly recommend working with a practitioner because they are so sensitive, their constitution so sensitive, and you don't want to disrupt that constitution. Okay. Do food sensitivities mean you have to stop it or limit it? Great question. So when you have food sensitivities and you have eczema, I do recommend for a period of time to often stop food sensitivities, but it also depends on how severe those food sensitivities were, how many food sensitivities you have, because if you have a ton of food sensitivities, let's say you do a food sensitivity test and the whole entire list is positive, then it's not really about the foods themselves, but it's really more about how leaky your gut is. Your intestinal permeability might be really high. So in that case, you're not going to avoid all those foods. You might now limit it and minimize it instead of taking it all out. I mean, that would just be impossible. If everything on your list came up, you have to eat something, right? And again, at that point, it's not about the food itself. So when that happens, we might focus mostly on the top allergenic food. We might focus on high histamine foods, but we'll let you eat those other foods, and then we rotate the rest of those foods. So what I will have to say is, I think a lot of people are getting food sensitivity tests on their own, but then they actually don't know how to read it, don't know what to do with this information. When you get a food sensitivity test, you really need to actually zoom out and see the whole picture and then decide, okay, what do we do with this information now? And, that's why it can sometimes be difficult if you're ordering these tests and then you're kind of not sure what to do after that. Okay. All right. Thank you. Would I request a GI test through our pediatrician, or if we join your program, would you suggest who we see for the proper testing? Yeah. Your pediatrician likely does not do these GI tests unless your pediatrician is an integrative pediatrician. In that case, your pediatrician might do it. That would be one thing. If you have a functional or integrative pediatrician, there's a possibility your pediatrician might do these tests. Unfortunately, though, most pediatricians are not doing this. Most pediatricians are not asking about the root cause. And so working with a naturopathic doctor like myself is a place to start. My program, if your child has eczema, is very specific to eczema. And so, myself and my team, we mostly work with eczema patients. And so you're really getting a team that really knows, eczema in and out, just because that's really all we're seeing in our practice. And so that is one benefit, because sometimes what I've noticed, first of all, in my own healing process, seeing naturopathic doctors with skin conditions, especially like eczema, sometimes you're going to give products or supplements that actually elicit more of a response. And so, I have a lot of experience with that from a personal place and also from a clinical place. And so we use a very specific route in terms of healing. Let's say if there was a parasite for an eczema patient, we do not start with killing that parasite at the beginning. We actually need to help the body to heal first before we actually can kill that parasite, because if you start to kill that parasite at the very beginning, now this eczema person may have a flare. And so with eczema, there's kind of a very specific route to healing, and someone who really deals with eczema would know that. So I would recommend, if you find someone who deals with eczema, solely or specifically, and then of course me and my team at Clean Body do solely and specifically work on eczema. Okay. All right. Okay. Any other questions? Please go ahead and type into the chat box now. Again, I'm happy to answer any and all questions. And we are talking today about treating the root cause of eczema in children and babies. And unfortunately, this is a big, big problem in today's world. A lot of our children and a lot of our babies are coming out with eczema. And so if you missed the live, I will be posting this on Instagram. This will also go on my podcast, Live with the Eczema Doc, in about a week. So you can check this out there too. And if you have not joined my podcast yet, definitely follow it so that you can hear, what I have to say about eczema every single week. I'm trying to respond to things that you guys are asking me. And so I've been getting a lot of questions about eczema in babies and children. So that's why I wanted to cover that today. Okay. All right. I don't see any other questions coming in. If you guys have any last minute questions, please type into the chat box. Otherwise, thank you so much for joining me today. And again, I go live every Wednesday at 12:30 p.m. PST. And then these lives do go on my podcast, Live with the Eczema Doc. Also, lastly, if you want to read all of this information, I do have a blog as well. And you can DM me. I'm happy to send you that blog directly, the link directly. Or go ahead and just go to the link in my bio, and the blog link is there as well too. Okay. All right. I don't see any other questions coming in. If you guys have any other questions and we've ended the live already, just DM me or send me a direct message on Instagram. I'm happy to answer that. You can also reach us at cleanbody.health. So you can go to our website and you can contact us there. We're happy to answer any questions for you. All right. I hope you guys all have a great week. And it looks like we have one more question. Do you treat young adults? Yes. So I treat people of all ages. So today we are talking about children and babies. And that is because a lot of children and babies, unfortunately, deal with eczema. But I treat people of all ages. So I see people who are babies and children. Then I see teenagers, like those who are young adults, as you're asking. I see adults, and I see, all people of all walks of life. And we mostly focus on eczema, but we also do see people with other chronic illnesses and chronic diseases as well. We mostly focus on inflammatory diseases, which eczema is a part of. So yes, we absolutely do treat young adults. Okay. All right. Any other questions, please type into the chat box. I'm happy to answer them. And I don't think I see anything else coming in. Thank you so much to those who contributed today, who asked questions. And again, I'm happy to answer any and all questions if you guys just want to reach out directly. Okay.